The event is called Progressive Simulation, and it allows the health science programs to work together. So the EMS students get to interact with the nursing students, radiology students, and so it's an opportunity to kind of create a simulated event where they can transport patients into the hospital and work with the other programs. So we have some people who come in from the community and act as simulated patients, and so they receive moulage, so makeup that looks like injuries, and they come out and act out the injuries so that our students can deal with live patients. So that presents kind of a unique opportunity where they have to communicate a little bit more than they normally would with our standard mannequins. And so then that interaction is very helpful. But then interacting with the hospital staff, having to give a report to somebody who's a stranger that you don't work with on a daily basis is the interaction that they're going to be dealing with all the time. And so this event provides us a lot of those opportunities that we don't typically get on a day-to-day basis.
We got here at 8 o'clock. We went into the debriefing room and she kind of gave us a heads up as to what was going to happen. With all of the different departments kind of collaborating together today. And then before you know it, the EMS people were starting to bring us patients, so we could hear them over the radio kind of talking to each other, and then the ball was rolling after that. And so we just kind of had like a continuous flow of patients coming in, just like a regular ER. And before you know it, we were all done and back in the debriefing room.
I saw 3 cases today. Felt like a real hospital here at Blinn College, so it's really cool being able to do our job, hand off, let them do their job, and just communicate between the different groups. I loved being in a leadership position and leading my team and telling them what to do, so I had really fun assessing the patient, figuring out what to do next, problem solving. I think that patient contact is one of the most critical parts of medicine, and I think that you get so used to mannequins just sort of sitting there and letting you do whatever, you forget that you're dealing with real people and having to have actual conversations, checking up on them, making sure they're okay. So I think today was very important for us as future practitioners in medicine.